Dr. Roman Hunter, and today we're going to be talking about manual muscle testing, otherwise known as MMT. Now, MMT has 6 grades, from grades 5 to 0. Grade 5, otherwise known as normal, is when the person is able to complete full range, or in other words, throughout the available range of motion, and is able to hold against maximal resistance. The muscle is able to hold against maximal resistance. For grade 4, otherwise known as good, is when the person is able to complete the full range or the available range of motion and is able to hold against moderate resistance. So if you were to apply maximal resistance and the person breaks, that would be a grade 4, right? So it's moderate resistance. For grade 3, otherwise known as poor, or fear rather, my apologies, is when the person is able to complete full range without manual resistance. So they're able to complete full range or go through the available range or go to any range just against gravity, in a gravity maximized position, all right? For grade 2, otherwise known as poor, is when the person is able to complete partial range. They're unable to complete the full range, just partial range, or you put them in a gravity minimized position and you're able to perform the full range in a gravity minimized position. All right. For grade 1, otherwise known as trace, is when the person just has a palpable contraction or a visible contraction. And for grade 0 is when there is no visible nor palpable contraction occurring in the muscle. And 0 is otherwise known as, you guessed it, 0. All right, so when performing MMT, you want to make sure that the body part is exposed. You don't want to have it fully clothed or you have bulky clothing over the area that will limit the range of motion, and you won't be able to see any visible muscle contraction occurring. So you want to make sure that the area is exposed and you drape them accordingly. All right. Now, in terms of, just before we go, I just want to also mention that for some joints, there may be some arthritic changes that will affect the range. So the person may not be able to perform full normal range of motion just because of arthritic changes occurring within the joint itself. May also be due to capsular issues or some internal derangements occurring in the joint. So you allow the person to take the limb through the available range that they have within their capacity, through the available range, or you take them to the end of their range. They're able to take themselves to the end of their range. And you perform the test within their available range that they have. All right. We're going to be doing MMT, that's manual muscle testing for wrist extension and wrist flexion. Okay. Now the testing technique is similar for the both of them. Is just the position of the forearm that is different. All right. The primary movers for wrist flexion are the flexor carpi radialis muscle and the flexor carpi ulnaris muscle. The primary movers for wrist extension are the extensor carpi ulnaris longus and extensor carpi ulnaris brevis, as well as the extensor carpi radialis muscle. Right? Those are the 3 that are responsible primarily for wrist extension. There are other muscles involved as well, but those are the primary movers. Now, if you notice here, with regards to testing from grade 5 to grade 3, the position of the patient, and you want to make sure that the limb to be tested is resting on a surface, a solid surface, and the position of the therapist or the examiner is right beside the limb to be tested. Now, the stabilizing hand will be stabilizing the forearm so that when the person flexes or bends the wrist, they don't lift up the entire limb. So I'm going to be stabilizing the forearm, and I'm going to go ahead and give the instruction. I want you to go ahead and bring the hand up towards the face of it. Now you can see that good movement there. The very fact that she can perform this is already a grade 3 because she's able to lift the hand up against gravity, right? So that's a grade 3. Now I'm going to go ahead and check to see whether it's a grade 4 or 5. Okay, so I'm going to go ahead and apply the resistance. Keep your hand in this position. Don't ever pull it down. 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 Now, if the person breaks under maximal resistance, that will be a grade 4 out of 5. If it is that she's able to hold under moderate resistance, that's also a grade 4. If it is that she holds under maximal resistance, that's a grade 5 out of 5 for MMT for wrist flexion. Okay? Wrist flexion is done in this position, supinated, not pronated. Okay? Now, I'm just going to go ahead and flip it around, just to do the same thing for wrist extension. Go ahead and move the hand now over. So this is for wrist extension in prone, all right? So the forearm is in prone position, palm down. The whole entire limb is resting on a surface, not on the edge of the surface. And I'm going to go ahead and provide and apply stabilizing hand over the forearm. I'm going to give the instruction, lift that hand up for me, please. And she's able to lift against gravity, that's a grade 3. Apply the resistance now, testing hand. Applying the resistance on the dorsum of the hand. Applying the resistance, hold it, don't ever push it down, keep holding, and that will be a grade 5. Alright? Now, let's say that she's unable to lift it against gravity, whether for flexion or extension. She's unable to lift it against gravity. So we're going to say we need to put it in a gravity minimized or gravity reduced position. So what position is that? We're going to go ahead and move the forearm into neutral. This neutral position between pronation and supination. And in this position now, I'm going to go ahead and give the instruction. I want you to move the hand inwards for me. And she's able to move it inwards in a gravity minimized position. So this will be a grade 2 for wrist flexion. Okay. Now, same principle, same concept applies to wrist extension. Please move the hand out, move towards me, and there you go, that will be a grade 2 for wrist extension. Great. Now, those were the different movements that you can perform for grade 2 for wrist flexion and extension. And if it is that she's unable to perform the movement, then it's still palpate and check for any visible contraction of the muscle for wrist flexion. Put the limb back in supination for flexion, and this will be a grade 1 or 0. If it is that she's unable to move the limb and there's no contraction going on, you can't see a contraction, you don't feel anything, that would be a 0. If it is that she's attempting but there's no movement, you feel the muscle contracting, that will be a grade 1. Same principle applies. You flip the hand over for wrist extension and you palpate, right? You palpate the dorsum or the posterior aspect of the forearm, distal, close to the wrist area, and you're palpating for any muscle contractile activity. Go ahead and try and attempt to lift that wrist up. She's unable to lift it up, but I feel something going on there, that will be a grade 1. Or, there isn't anything going on, I don't feel any contraction, I don't see anything happening, and that will be a grade 0. So there you have it, from grades 5 to 0 for wrist flexion and extension.